Hello, and welcome to the September 17th meeting of the Sedgwick County CARES Stimulus Review Team. Today we're going to be covering the scoring matrix that is used for scoring the applications for prioritization, as well as talking about our special meeting on September 23rd to begin reviewing applications. Before we jump into the meeting, I'm going to go ahead and take a roll call. If you could let me know that you're here when you hear your name. Melody Miller? I see you, Melody. You're fine.
Here.
Awesome. Mark Manning?
Here.
Mm-hmm. Jane McHugh?
Jane indicated last week she probably wouldn't be here.
Correct.
Yep.
Okay. Kiel Mangus? He was here. I see you on here.
It looks like it says keeps saying connecting, trying to connect to audio on over his name.
He may have been the call-in. Oh, I'm here. Gotcha. Gotcha, Kyle. Dr. Walker, I'm not seeing her. Hope?
Here.
And Brent.
Here.
There's Dr. Walker. Well, it looks like we have enough for a quorum. So with that, Brent, I will toss it over to you for adoption of minutes.
Good. Thank you, Aaron, and thanks to the members of the Financial Stimulus Review Team for joining us again this morning. And if you happen to be watching this on YouTube or Facebook live stream, welcome this morning. The committee received the minutes from the September 10th, 2020 meeting. Do we have a motion to approve?
Move to approve.
I'll second that.
We have a motion and a second to adopt the minutes from September 10th. Can I hear all those in favor?
Aye.
Aye.
Any nays? Hearing none, minutes are adopted.
Any new business before we get into the scheduled items that are on the agenda?
I don't think it's new business, but I do have I want to clarify that if I have questions about the applications, and specifically for me, missing information that's on the application, will staff call them and attempt to gather that information? Or maybe it's somewhere, maybe you've already asked and I just need to be able to access it. I'm just wondering.
Well, if you have specific question about a specific application, if you email that to Hope or to Shannon, Aaron, then we'll go through the process of getting that information. And then when we meet next week to discuss the applications specifically, then we'll have that information available.
Okay.
Yeah.
Brent, this is Melissa. I know you're going to talk in more detail about the September 23rd meeting, but can you say a little bit about what's going to happen at that meeting?
Sure. At this point, what we are planning is that the BOCC room will be available. We're going to open that up shortly before noon. Anybody that wants to attend in person is welcome. You'll get an email from Aaron. In the meantime, sometime between now and then, we will provide lunch for those that want to come in. And then we will begin walking through applications based on how they've been prioritized using the scoring matrix. Another suggestion, we may take an entire category of expenditure at once. That's been recommended by Kyle. So the goal for that meeting is to get through as many, if not all, of the applications and make the award recommendations. Any follow-up that we might need, we're still scheduled for next Thursday at the same time, so we can pick them up at that point. But we've got the room reserved from noon till 5, and that's kind of what we're going to try to do, is go through them and make award recommendations on that day. And from everything with the higher the prioritization score to the lower is how we would take them in that order.
Okay. And the financial assessment will already be completed for that meeting on the 23rd.
It might
But
be.
you're calling it the risk assessment. I call it the financial assessment.
Okay.
But
So,
whatever, same thing.
Right. That assessment, those may not all be done by the time of that meeting, but this committee doesn't have to be concerned with whether it's a higher risk applicant or request. That's more for us to use internally in terms of how we monitor the performance after the award is made. So if for instance, it's a great program, but it's a higher risk application or a higher risk program, that just means we're going to be, we'll use more diligence as we go through the monitoring process. So
Okay.
we're going to do everything we can do to assure compliance. It may mean more review of the receipts. It might be more review of financial information or whatever. So our guidance was from the consultants was this committee focused on the program effectiveness or efficacy, and then internally we'll use that risk assessment to determine how we monitor them.
It doesn't make sense to review for the committee to review applications if the financial assessment score is so high that you think it's unlikely that an applicant would be funded. So since it's unlikely we'll get through all the applications on the 23rd, could we perhaps set aside the applications from organizations that have an extraordinarily high financial assessment score?
Even if an application or an applicant has a high risk assessment, but they have a worthy program, that might mean that they are only going to be reimbursed for expenses that have been incurred. We're not going to advance them any funds. We're just going to make very certain that they are in compliance before they receive the funds or as we go through that process. But our accounting guidance and the guidance we received from BKD specifically was that the committee need not be concerned about that in making those awards. So they can be high risk and still be funded. It just means we're going to be much more risk averse in monitoring them.
Okay, that's very helpful. As we review the applications, it's good for us to have that information so we know how to evaluate each of the applications.
Right.
I also have a question about the service assessment or the service priority assessment, the matrix.
Mm-hmm.
Will those scores be assigned by the staff, by you and your staff, in advance of the meeting on the 23rd? And will we receive those service priority assessment scores in advance of the meeting on the 23rd?
Yes. We're meeting tomorrow morning, and then as often as we need to between now and then, we're scheduling another meeting Monday, because we may get some more applications up until the deadline on Sunday evening. So as we assign those scores internally, and we're doing that collectively, though that information will come out. Now, if you disagree with that, that's fine, but that's just kind of how we'll prioritize them for the the review process as we go through the meeting on the 23rd. So you'll know what our suggested scoring is at that point.
On the 23rd.
Or it'll be before. As we get them scored, we'll send you that information.
Okay, that's also helpful information to have. As we discovered going through the financial assessment, sometimes we had questions about the allocation of points with respect to some of the applicants, and I'm sure that will happen with the service priority assessment as well. So we'll review those assessments with each application on the 23rd, and we'll have an opportunity to discuss the service priority assessment score.
Right. Yeah, I doubt if the 7 of us sat down individually, that we would all come up with an 8 for a specific agency. There will be some differences, and then that's what we'll have healthy discussions about.
Yeah, I personally am going to go through the applications with the service priority matrix and score, and then see how you score, and we'll see. It's like a validity test. How reliable is this matrix? Do we all come up with the same score?
I do have a question regarding financials. I noticed that a particular organization, large, probably one of the largest, is requesting a large amount. Is there a reason for us to actually see or request their financials? And I'm not referring to the financial risk assessment, in order to validate, I searching for the word, that indeed the request being made is for this COVID period and not associated with any other financial challenges that has potentially faced this organization.
That would be part of our monitoring process. So as with all the programs, we're having the agencies or the small businesses in that program or so forth, they're self-certifying that these are COVID-related expenditures between March 1st and December 30th. We'll be looking at that as they provide us with documentation, receipts, and so forth. If they've got receipts from February, they're not going to work. If they've got ongoing expenditures beyond the first of the year, we will have already funded, but that'll be subject to return of the money or whatever. So we'll be tracking that as part of the follow-up monitoring.
That answers my question. Thank you.
Okay. Any other questions this morning? If not, let me give control of the meeting to Shannon. She has provided you with the spreadsheet with the applications that we received up to date, and then another spreadsheet that talked about some of the other funding that the agencies might have received. So I will mute and give this over to Shannon.
We can kind of hear you, Shannon. Are you there?
Yeah, I'm here. Can you hear me now?
Yes. Good.
Okay.
I can't hear her.
Say,
I'm sorry. Okay,
we can cut. I think you're cutting in and out there, Shannon. If you've started your presentation. And now we can't hear you at all. If you like, Shannon, we can move on to the scoring matrix and then come back to you.
Shannon, your microphone is muted, so on the Zoom screen at the bottom in the lower left corner, click on the mute the microphone and we'll be able to hear you probably. You need to unmute. Nope, you're still muted. Sometimes the panel at the bottom, you have to have your cursor on the bottom of your screen and then it pops up. And all the way over on the left, there's a microphone. It says mute on yours right now. You won't need to click on it to unmute it. Still muted. Erin, do you have control over Shannon's mic? Do you need to unmute her? Is that what's going on?
Shannon has, guys, this is Lindsay. Shannon has texted me to ask that you all move on for a moment, and she will maybe try and call in or figure out another way to communicate.
Okay, we can do that. Brent, do you want to jump into the scoring matrix?
Sure. Let's see here. I'm starting to share my screen. Don't know if anybody can see it yet.
Yes, we can. Perfect. Thanks.
Okay. So this was the final iteration of the scoring matrix. Is it large enough to see?
Yes, also we have copies of it so we can just open it up on our computer too.
Okay. Basically, it is set up so that the top, if we go down column A, the alignment with the strategic plan and making sure that we're focused on our historically disadvantaged or at-risk populations. That is, there's 4 points available for that. 2 points are available if there's a yes in any of these areas that are highlighted in yellow. So if they're helping, focused on people with mental illness, homelessness, any of these issues that are these populations that we identified. And then there's another 2 points available if the agency is, or the program is providing direct service, as opposed to administrative things, or as Melody has discussed, we're focusing on an at-risk population, so we're getting more benefit because we're keeping folks that are on the edge of homelessness, maybe staying away from homelessness by helping fund some of these projects. So that's the top section. The 4 points are possible.
Brent, this is Melissa, of course. I have a question.
Mm-hmm.
Sorry.
Okay.
On the last 2 points in this first section, Do you get 1 point if you're providing direct service and an additional point if you're serving at-risk populations to mitigate the impact of COVID-19?
Right, I think that the way I set that up, and the way I will use it would be that you could get, based on the effectiveness of the service to that at-risk population, or maybe the exponential benefits that might be received because we're getting, more effectiveness because it's at that population, that it could be 1 point, it could be 0 points, 1 point, or 2 points. So it's kind of the effectiveness measure that we had talked about.
I
The
think
outcomes indicate maybe an oversized effectiveness, if you will. Kind of going back to what we discussed last week.
These 4 points are trying to determine the degree to which an applicant is addressing a population that's served by the county and also addressing a population that's at risk, particularly vulnerable to the effects of COVID, and addressing, applying for funding to support direct services to those populations, to individuals served by county services and part of the strategic plan, as well as individuals who are at risk, which could be racial and ethnic minorities. It could be people who are vulnerable because of their experience of severe mental illness, so on and so forth. So my recommendation would be to score that the second 2 points of the 4 points having to do with target population. Is you get a 0 if you're not proposing in your application providing direct service or providing direct services to mitigate the adverse effects of COVID-19. You get a 1 if you're proposing or are providing direct services, and a 2 if you're both providing direct services and addressing risks that will mitigate the adverse impacts of COVID-19 for a vulnerable population.
Okay.
I'm not sure I'm following. Melissa, if you could explain that again.
It's clear in my mind, but possibly only my mind. So let's try this one more time. There are really 3 different things that we're measuring here in this first 4 points.
Right.
Okay, so the first item, you get 2 points no matter how many, no matter which target group you're serving, which I'm fine with. If all of your services target people who are experiencing mental health challenges, behavioral health challenges, then you get 2 points. There's no half a point or 1 point or 0. It's a 0 or 2 thing.
Great.
And in that case, the 2 gives weight to your addressing the needs of people who are homeless or experience IDD or have behavioral health challenges, etc. Is that clear?
Mm-hmm. Yeah, I got that.
So it's either 0 or 2.
Correct.
No bonus points for serving multiple populations.
Right. All of them, it doesn't matter. You just one of them. You got 2.
Correct.
Okay. And then the other 2.
Okay. The other 2, I'm not sure that the language here quite reflects what I have in mind, but I think there are 2 dimensions to this second step.
Mm-hmm.
The second step is a little bit about the target population or the people that the agency is serving. And it also is asking about direct services. As Brent suggested, I mean, if we're providing support to people in an agency to work remotely so that they can deliver direct services, then that applicant would get a 1. If they're asking for arguably all PPE, all disinfecting requests would have a direct service impact. So it's likely that most applicants will get a 1 if they're requesting funding for direct service. If an applicant is only requesting support for administrative purposes, then they get a 0 for that first thing. So I'm saying you could score 0 or 1 related to direct. Are you requesting support for direct services? You have to answer that question, yes. The application cannot be solely focused on a reimbursement request for administrative costs.
Right. Is that up under change in service delivery, or I'm still with the 2 points up under align with the strategic plan?
Yep, I'm there too.
Okay.
So I'm just dealing with one of the points of the 2 points.
Oh, and so you're suggesting and recommending us to consider breaking up those 2 points.
Yeah, either they can be separate points and you can score 1 on each of them, or we can roll them all together like they are here. But there's a second step here, or question here, which is, nowhere, we had a really long conversation the last week when we met about racial and ethnic minorities and the inequities and unequal access to care. Mm-hmm. There's no language like that here. It could be in this 2-point item, or it could be its own 1 point. 1 point for requesting funding for direct service, and 1 point for mitigating the adverse impact of COVID-19 on racial and ethnic minorities and whoever else we want to put in that bucket. Okay, so what you're doing is clarifying the language so that it's expressly and explicitly targets these groups. It's stated. Yeah, there's no, it's clarity. Okay. Yeah. So when we say, and that was one of my points, was to be able to actually describe describe who historically disadvantaged persons are. And is that where is there a definition? I don't necessarily see one. There are lots of definitions.
Yeah. I know, but so that's the point.
Yeah. Most of our conversation last week centered on, we had a lot of conversation about racial and ethnic minorities, and that is appropriate because they are more likely to contract, to test positive for COVID-19. They're more likely to be hospitalized. They're more likely to experience complications, and African Americans are 3 times more likely to die.
Right. So we talked and all correct, and that's exactly when I just put it in the disparities that exist and the racial disparities. So when we talk about racial or ethnic minorities that have been subjected to racial prejudice, that's but one of the. This question actually is for you, Brent. So it's categorized, and I'm looking at the yellow highlighted, where we have racial and ethnic minorities that have been subjected to racial prejudice. We have LGBTQ or those subjected to prejudice based on sexual orientation or gender identity. We have gender discrimination, people with mental illness, citizens, senior citizens of, or the aging population, developmentally disabled children or adults homeless, uninsured or underinsured, and people with substance abuse addictions. Is this to define who historically disadvantaged are, or that's within the strategic planning mission of who Sedgwick County is going to focus on when providing services? I need to be clear on that.
It's a messy mix of both.
Yeah.
It'd be neater if we separated mental illness, aging, developmental disability, homeless, uninsured, addiction into its own category. And then I'm not exactly sure where gender and LGBTQ came from in addition to racial and ethnic minorities, but I think that's fine to include. It's just not, they're characteristics of service recipients that result in historically not being able to access treatment, in particular social services and healthcare. And then there are the attributes of program participants that have to do with the condition that the organization is addressing. Behavioral health, older adults, IDD, homeless, etc. Addiction.
So in essence, go ahead, Brent. Yeah.
I was just going to say that based on the comments we had last week, and then looking at historically disadvantaged populations, that was my attempt to articulate who those might be. If we want to add to that list, we clearly can. I don't want to make.
I think we like the list. We just want to reorganize it a little bit. So how about in the first 2 points, it's just the services. So yes, people with mental illness, so on and so forth. And if you say yes to serving any one of those populations, you get 2 points, one or more. And then I think we want to emphasize that the applicant is using the funding for direct services. They can use it for administrative purposes as well, but they need to be able to demonstrate that they're using it for services. That's another yes/no question. If they answer yes, they get 1. Or if we can answer yes in reviewing the application, they get 1 point. And then the final 1 point of these 4 points would be, are you addressing the needs of a population that historically hasn't had access to health or human services? For example, racial and ethnic minorities, LGBTQ, on the basis of gender, so on and so forth.
Here's a stab at some language. Tell me what you think.
Okay.
So I'm into the second 2 points. We split up 2 1-point answers. Does the funding support for the agency/program directly support frontline service delivery to those most at risk, as stated above, or something like that? And then the second thing would be, is the funding support directly applied to current COVID-19 mitigation for the above mentioned at-risk or historically disadvantaged populations, or those in the county strategic plan or something? So it's, does the funding support directly support service delivery, and is the funding support directly applied to current COVID-19 mitigation for the above mentioned population, something like that.
It's still like that one point, the last point that you just made, to say, will the funding be used to mitigate the adverse impacts of COVID-19 on racial and ethnic minorities, LGBTQ? If you're thinking about women in gender discrimination, you could mention that. I don't know if that's what you're thinking. I'm not sure how to think about that one.
So,
For example, e.g.
mm-hmm. So my major focus last Thursday, and what I'll reiterate, is that I think it's fine to denote and to explain, describe historically disadvantaged populations as what you have. When you peel back and look at the actual death rate, infection rate, and lack of access to, or the high number of persons that are on the front line, then we're going to be looking at Black and brown folk. So when we talk about, for me, I would like to know how these businesses or organizations are actually recognizing that there is a disparity glaring nationally and statewide, and certainly at the local level. What we have here, captures it all in one fell swoop. So it's prioritizing all of these. I don't know how to, and that's for, obviously that's going to be consideration of the total group of the committee to focus even further on a particular population. But that, I just wanted to clarify that that was my thinking. And so what I see, and I hear you, I think I understand, Dr. Walker. I'm not sure that parsing it to the 1 and 2 points will be easy for us as a group to do. I think that that may cause it's going to cause some questions, but it's going to take a little bit more time. So I'd love to hear your response to that. But what I see here are 4 points that goes into these historically disadvantaged populations, groups of people. The 2 I'm good with. It's just splitting up the last 2 that I need to be really clear on how this committee will proceed and that it won't bog us down. Dr. Walker?
This is Kyle. I agree. I guess Melody and Dr. Walker, when I look at the scoring matrix, everything past this section I'm good with. And I understand the first part. I guess where I get confused is the first 2 points out of the 4, does it serve a historically disadvantaged or at-risk population? And we're talking about breaking up the second 2. Does the agency provide direct services to those most at risk? So you're defining a group that's listed up above. I guess in my mind, and I don't know the stats as well, some of the things you guys have said, and I appreciate that, but I guess I don't know if somebody's serving a historically disadvantaged, aren't they providing direct services? So is that repetitive, or am I thinking of that wrong?
I think you're thinking of it just right. Okay, my turn, Brent, to wordsmith. You ready?
Okay.
So the first 2 points. Does the agency or program serve one or more of the following populations? This isn't exactly the right words, but individuals who experience mental illness, senior citizens or the aging population, intellectual, developmentally disabled individuals, people who are homeless, people who experience substance abuse. That's it. Then it just stops. Get 2 points if you say yes to any one or more of those. Okay, second item. Does the agency or program provide direct services to anyone? Actually, wait. Yeah, I just, see, when you say it out loud, it is confusing. Okay, so now we have the target populations in the first question. You get 2 points for that. And then the question becomes, we want to distinguish between agencies that are proposing to provide direct services and those who are asking for funding for administrative costs. So we could just simply say something like, is the agency or program requesting funding for direct services, to provide direct services to one of the above populations, one or more of the above populations? And you get a point if you answer yes to that. And then the fourth and final point in this section would be this. Does the agency or program provide services to mitigate the adverse impacts of COVID-19 by serving people who are, and this is my personal top list, people who don't have health insurance. So economics is driving this in large part. If you're not employed, if you don't have employer-sponsored health insurance, if you don't have health insurance, you're not going to go to the doctor if you're experiencing symptoms or if you need treatment for COVID-19. So does the agency or program well, I used your language, or I tried to. Is the agency, will the program, is it proposing services or providing services to mitigate the adverse impacts of those most at risk? For example, people who are uninsured or underinsured, just borrowing from the language you used up top, people who are racial or ethnic minorities, or others who are experiencing disproportionately the effects of COVID-19.
I think if you, yeah, because that's weighting. That's weighting that's prioritizing and weighting these different areas. So the question is, did Brent get it? Brent?
I guess the question I have, Dr. Walker, would be, we asked does the funding support direct service delivery versus admin costs in the next section? So are we kind of doubling up on that with the first part of we're saying, does the agency provide direct service versus admin for the at-risk populations, which is a little bit different, but it's still another
I think that's a good point. We only need to ask that once.
Yeah, because you're giving them, it's like you're counting against them twice or giving them double.
So
Here's
maybe
what I
we
was-
just leave that where it is, the question about direct service delivery, and take it out of the top item. Sorry,
And here's what I was trying to get at with that top
Sure.
section. Do they serve these populations? 2 points. Are they good at it? 2 points or 1 point. So, and that's kind of where I was focused with that. Because we had talked about, do they have performance measures? Do they have outcome that they can demonstrate?
Right.
So fundamentally, that's where I was headed with this. Do they serve these groups? Are they good at it? So,
okay,
Just-
so we can
Is it
still,
program-
we can maintain a good point, 2 really good points. This is messy. Okay, so the first point is, who do you serve? Mental health, et cetera, et cetera. Second point is, can you demonstrate effectiveness in serving this population? Right? We don't have to ask about direct services because Kyle's right, you did that below. I forgot that. And then somehow, some way, ask if the services that the agency provides or is proposing to provide will mitigate the adverse impacts for people who don't have health insurance or are uninsured, racial and ethnic minorities, and whatever other categories you want to put in there. But you need to say "and other," because Melody's right. We can't think of everybody who's been adversely impacted by COVID.
I don't think it's somehow, some way. I think if you write it just like that, I think that's clear. Clear as mud, maybe. I don't.
No, I think we're making progress.
So can I ask just a kind of general clarification question here? Because I totally understand what we're trying to do, and we want to align with the county's strategic plan, and we want to target dollars to populations and areas that are particularly at risk, and those are both really good things. But, Via Christi Hospital, I could argue, serves ethnic minorities. They serve everybody. So how do we make sure that and maybe we've already done this, but we want to allocate the dollars not only to entities that serve ethnic minorities or every other category, but that's their target, right? Like, I'm going to say that the council elders is probably a lot more targeted at serving ethnic minorities than Via Christi, but yet would we both give them 2 in this area? Because that wouldn't be right, in my opinion. And maybe you've already thought about that, but that's my comment.
I think that's a really good point, Mark. I think if an agency specializes in serving at-risk populations, they get this point, the point.
Okay, that's perfect. That's, I guess, where I was trying to head.
Yep.
Yeah. And I don't know that it's, when you say specializes, I think it's more about targeting the services. It's the services being provided, that those services that are being provided are clearly identified and focusing on these populations, these racial groups, this population. And if you're looking at the broader side of it, let's say Ascension, I don't know how many programs they have that are focused on these populations in order to mitigate the adverse impact of COVID.
Yeah, that's
I don't
perfect.
know.
That's what I thought. I just wanted to make sure my thinking was aligned with what everybody else was thinking.
Yeah, good.
Okay. I'm not sure what to write in that bottom box, or if it's two boxes. Do we?
I think it's 2 boxes, isn't it,
Okay.
Melissa?
Walk us through what you have, Brent.
So the first box would be something that just discusses effectiveness in, does the program or the agency have some sort of outcomes that demonstrate some effectiveness? And then the second one, will this funding support will it support mitigation efforts for those that are most at risk of adverse impacts of COVID-19?
For example, people who are uninsured,
Right. And I
etc.
think that the hospital does that from time to time. They'll provide service to under or uninsured.
Yeah. If you're going to follow Mark's logic, and I think we do want to do that, it probably needs to be worded in a way that says something like the agency or program primarily serves individuals or populations who are most at risk, or to mitigate the adverse impacts of COVID-19.
Mm-hmm.
For example, people who are uninsured, racial and ethnic minorities, and other groups.
And I think it's important to actually put the EG.
Yeah.
Otherwise, it becomes whatever the interpretation of the person.
Could you use the word prioritizes versus primarily serves? Prioritizes service to? Does that make a difference?
Yeah, I like that, Kyle.
Mm-hmm. Yeah, I think that's as clear as it gets, Kyle.
Okay. Let me suggest this. Let me suggest we look at the rest of this, and then when Shannon is going over the spreadsheets, I'll do some wordsmithing and we can come back to this. I'll see if I can encapsulate these comments.
Sounds good.
Okay. Well, the next section just speaks to any alterations in their service delivery. We've got the changing the way they deliver the service, direct service versus administration, and does it restore or maintain their capacity to serve their clients? And then moving on to the next one, if it's a funding request for PPE or disinfectant care, that got 2 points because that was specifically identified as a priority. And then the following one, it was kind of an either or. Tell us you're going to spend the money by December 30th, or if you're standing up a new program, can you get it stood up and spend the money by December 30th? So the first one is ongoing program. Can they meet the deadline? And if they're going to stand something up new, can they get it done by the end of the year? Max points then are 10, and we would put them in 3 different groups, 1, 2, or 3, depending on the score. 8 to 10 is a priority 1, we'd look at them first. So in that example, let's say we have an agency that doesn't necessarily target any demographic, but they're pretty effective at what they do. Without getting 2 points at the top, they could still be a top priority. I mean, they could have effective programs. Maybe everybody at some level is going to have some exposure in that first category. But we would then just group them 1, 2, and 3, and that's the order that we would take them. And then on the bottom two, two things we heard specifically from the county commission was that the funding request be specific to the county. So if it's a regional agency with a regional program, we'll fund the Sedgwick County part. And then the other part was sustainability. If we do anything new or they've stood something up, do they have funding to carry it on after the first of the year?
It seems like the last questions, does the spending request respond to current COVID-related needs, clearly demonstrate that funds will be used, encumbered, and services or goods delivered by the 30th of December. Isn't that part of the financial assessment, the risk assessment?
It is, but it's also, if they have, maybe they're going to bring on a position and they're asking for funding for this person through the end of 2021, that doesn't demonstrate that those funds would be encumbered by the end of the year. It's an ongoing program, or there were some things that we just want to make sure that they can demonstrate that it's a current need being met and paid for by the end of the year. So, I mean, it's part of the risk assessment, but if they've established a program or changing a program that they're not going to be able to pay for by the end of the year, it violates the, I guess, the CARES Act guidance.
I think that those points are well covered in the risk assessment. And maybe here, thank you for reminding us of what the commissioners brought up when we met with them. And we've talked about this a little bit too. Maybe what would be helpful is to ask the sustainability question. So to ask, are you asking them to encumber the funds or spend the funds?
Guidance says it has to be encumbered, okay, and services delivered by the end of the year. They could pay for them January 15th if the service has been delivered by 12/30.
Okay.
Okay, so, but there's some activities I can imagine that they would encumber funds for and spend funds for between now and December 30th that would put them in a better position in the winter months when the virus may be roaring again. So that's one dimension.
But but the guidance is that we're not to be taking, it's not for anticipated needs, it's for current needs.
Yes.
So
I understand, but still, you can imagine that if a service provider is set up to, we have many, many requests where service providers are asking to be reimbursed for computers and other technology that they need to deliver services remotely, and that will help them in the upcoming year in 21, and that's okay. I mean. Mm-hmm. That's permissible. So, I mean, what if we were asking about the way they're planning to use the money and try to determine the degree to which it will. We've been circling around this question of sustainability, and it's worth 2 points for sure. and I'm not exactly sure how to get at it. So I'm going to stop talking and let somebody else try and noodle about this. But what I'm trying to get at here is there are definitely things that agencies are requesting that will put them in a position to continue to address the needs of the individuals who receive services from the organization in the months to come. So that's another way to think about sustainability. You're in the risk assessment, we're thinking about financial sustainability of new programs or new activities. Although I don't know if that the financial assessment is explicitly asked about that, but we're also thinking about sustainability from a service perspective, right? Are they requesting funding that will help them continue to serve the population that they serve, or better serve the most at-risk population?
I think that's a great point, and I totally understand what you're saying. I mean, and I get what Brent's saying. We don't want to do something where the service delivery starts after 1 January, but if we can do something now that helps people between now and December 31st and maintains an infrastructure to continue serving after that, that's a really good thing, right? And that's permissible, right, Brent?
Yes, that would be, it is.
So my question is, so how do we, from a budgeting perspective, how do we know? How do we see that? And I don't, honestly, I don't want to go into that much depth, but I'm just saying, in terms of sustainability, in terms of seeding an organization for success and their ability to be sustainable in 2021, how do we know that? Because I know you're saying self-certified. Is that basically what we're going on? Our self-certifications?
Well, I remember, for example, one of the applications that received was requesting a new position, and they indicated to us that if they hired, that they had secured funding for 2021 for this position outside of CARES money, so that they demonstrated that sustainability. That's just one example that I can recall. If an agency has purchased laptops so people can work from home, or they can deliver service more effectively into the community, then as Mark said, they've established that infrastructure that is sustainable as they go forward. They've had to respond to the current needs by being able to work remotely, but that also is, that in and of itself would be sustainable going forward.
How so?
They move into the new year.
How so is in and of itself it would be sustainable?
Yep.
No. How so?
How so?
Mm-hmm.
Well, if for instance, I'm an employee of one of these agencies, and rather than coming into the office to see clients and do the work, maybe I'm working remotely, so the agency acquired some technology for me to do that. That met an immediate need.
Immediate, yes.
As I'm continuing my employment after the first of the year with them, but continuing to work remotely, I think that by itself just indicates that that's sustainable. We've established the infrastructure, helped them take care of the infrastructure to change the way they deliver service. They met a current need, even though it's going to continue after the first of the year. We're not providing funding for them to buy new software in February or do something like that. It's
okay.
That's kind of what I'm saying.
So assumptions are made, and we just simply assume that that's going to continue. And I'm fine. I'm just saying I'm just simply getting it clear in my mind.
Yeah.
Okay.
I think if the focus of the request is to meet the current need that was as a result of COVID, They changed the way they did business. They bought PPE. They did those things that they had to do to respond. So I think that in and of itself, if that way of delivering the service continues after the first of the year, that's okay. The foundation was established. If they want that they need additional funding after the first of the year, to the extent that they've demonstrated they have it or they don't need it from CARES, then that's the sustainability question.
Mm-hmm.
So I think that's both a program effectiveness question and it's a financial or a risk assessment question too.
Mm-hmm. Did we was there a decision that needed to be made on regarding capital expenditures, the temporary facilities that are being requested? This is probably more of a question for the committee.
Yeah, there's some in establishing temporary facilities or other type of capital expenditures. We kind of go back to the same question. Is it to meet the immediate need or is it meeting an anticipated need? So a capital expenditure to be ready to address a surge in the spring of 2021, on the face of it, doesn't look to be appropriate to me. But to establish a temporary facility to meet current COVID-related problems is, capital expenditure for that makes more sense than one, or it fits the guidance, whereas one that would, for an anticipated need, I don't think it does.
Okay.
So do we need to do anything with the 2 questions or 2 statements under whether the spending request responds to current COVID needs?
I think we do, but we're out of gas with this tool. So we trust you to wordsmith it and
Okay.
send it out to us, and then we can give you feedback via email.
Okay.
I think, at least that's how I feel. Hopefully my colleagues do too.
Yeah, no, I'm comfortable.
Okay. Watch your inboxes. It'll be coming.
Will do.
Okay.
And if you wanted to get those revisions back to me specifically, instead of sending them out to the whole group, that would be great. Thank you.
Okay.
To clarify, Aaron, you want us to send feedback to you?
Yes, please.
Okay.
And just to, send the feedback back to Aaron. We don't respond to all because I could set us up for a open meetings act violation. Okay, Shannon, are you where we can hear you now? And
Hopefully it's better.
all right, you're coming in loud and clear. So
Okay, good. So I'll go ahead and share my screen then.
okay,
Is everybody able to see that?
Mm-hmm.
Okay, so this is just the updated report of applications by category as of the 14th, which was Monday. I think we've maybe only had a couple more come in after that day so far. So it looks very similar to the one the week before. I added highlights to things that have been approved. So you can kind of visualize that. Did anybody have any specific questions about that?
I had a question about, let's go up. You were, about hospitals in particular. If I recall, I did not see any funding, but either funding, I don't even know if I saw the funding request for Ascension. Not for us, not for us, but any additional funding that would have been highlighted.
The second one that came in, is that what you're talking about?
Yes, the second one.
That one, yeah. That one we need to send on to you guys. It's just, I kind of held on to it a while, but yeah, we can definitely send that one out. We'll have Aaron send it to you all.
Okay, but no, what I was referring to is any other funding that hospitals in particular had received. Didn't we get another document that showed that?
Yes, you did, and I was going to go over that one next.
Okay, I'll wait. Thank you.
That's fine. I just added it as a tab on this report so I can tab that. Yeah, this is out of our software where applicants applied, and all of this is pulling from the application and information they filled out.
Mm-hmm.
So my plan is to add columns where we'll go out and actually check ourselves.
Oh, okay.
What entities have received as far as funding goes.
Okay.
So that I just haven't done that yet. So this is just what was self-reported by the applicant.
And will we know that before the 23rd on hospitals?
Yeah, my goal definitely would be to have that complete before then.
Very good.
Any other questions? If not, I will end my sharing. Is that all right, Brent?
Absolutely.
Okay.
Okay, I think that is everything that we have on today's agenda. Anything else? If not, then we'll have an updated scoring matrix out later today. We'll get the agenda out to you for the meeting on the 23rd. Watch for email from Aaron so that we can solidify whether you'll be joining on Zoom or in person. And if nothing else, I would entertain a motion to adjourn.
So, Brent, if we zoom in on the 23rd, are you going to ship us some food to our office here?
Oh, absolutely. I'll find a drone and attach it.
All right, that sounds good.
All right.
I'll move to adjourn.
Okay.
Second.
We've got a motion and a second to adjourn this meeting of the Financial Stimulus Review Team. All in favor say aye.
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 Any opposed? Very good. I thank everyone for your input today, and we will follow up with information based on what we've heard. See you all next week.
Thanks. Bye-bye.
Thank you.
Bye.